Well, welcome back, everybody, to the ICC International Trade and Prosperity Week. My name is Chris Southworth. I'm the Secretary General of the International Chamber of Commerce here in the UK. The session now is all about building back better the COVID challenge. For those of you that joined us earlier in the day, we heard some strong messages from the boardrooms and from the OECD on the need to accelerate COVID vaccines, and the sentiment was very much for me around, we can't trade effectively until we can all trade. In other words, we need to get the world vaccinated, then we can become mobile, get systems back up and running fully. So there was a very strong segue from the morning session to this session. Can I just say, before we start, a huge thank you to our sponsors and supporters. And for any of our delegates listening in, you can connect and meet and talk to each other on the event platform, and the content will be available for the next 7 days. So with no break, I will hand over straight away to our first keynote speaker, John Denton. John is our Global Secretary General for the International Chamber of Commerce and has been at the heart of the conversation with the World Health Organization, putting forward the voice of business, supporting the effort on COVID. So we really couldn't have anyone better. Over to you, John.
Thanks so much, Chris. And I'm actually unusually but I'm always super energized, but I'm particularly energized coming to this call. I've just come off an amazing call with the ICC, where many of you know we pride ourselves on being the voice of world business. And one of the challenges I set for the organization, if that is so, show me where we are in Central Asia, show me where we are in Francophone Africa, show me where we are in Pacific Islands, show me where we are in the Caribbean. And so since I took over as Secretary General, I've actually been putting truth to that story of the World Business Organization. I've just come off a call where we've actually formally launched now the ICC presence in Central Asia. So we're in Uzbekistan, Kyrgyzstan, Tajikistan, Kazakhstan, and on we go, and even to Azerbaijan now. So it's an amazing, I think, a tribute to the organization that we're wanted there, but it's actually part of us giving truth to what we're all about, which is giving voice to world business. And we talk about world business, we talk about the real economy, and we talk about ensuring that that works. So it's great to actually be sort of in that mode when I come and talk to you about what it is we've been doing in the context of building back post and during the pandemic crisis. Look, first of all, again, shout out to you, Chris, and to the team at ICC UK. What I love about the ICC UK, led by you and chaired by Paul, is just your preparedness to get on and get things done, and also to, I think, raise the temperature a little bit about some of these bigger issues, and particularly given the role that the UK plays as chair of the G7 and chair of the COP26 this year, the role you're now playing as well in the UK in the G20, the independent voice you now bring into the WTO. It's really important that UK business takes the opportunity that you present to actually ensure that its voice is heard, and so many fora, but working with us at the ICC on a global basis, it really does enable global Britain, I think, to actually have a global opportunity to present its voice. The theme that you've got, resetting the global economy, it could not be more pertinent. And the challenge presented, how to build back better during and after COVID, is one where fundamentally we'll need to quickly end the acute phase of the pandemic everywhere, deal with the many new economic frictions COVID-19 has created, and ensure we take this opportunity to build new systems that address long-term systemic challenges, most notably climate change. The view we take at the ICC, when we look at what we fundamentally do, which is we grow the global economy, we revitalize trade, and we advance sustainability, is if you want to grow the economy, revitalize trade, and advance sustainability, you have to bring this pandemic to an end. And that's why it's been really important for us to actually grapple with the issue of COVID in the context of what it is, which is really an existential issue for us. How do we ensure that we can actually grow the economy, revitalize trade, and accelerate sustainability? Anyway, so I've been asked to talk today about practical solutions, and I'm going to focus my remarks around that and focus it around the key initiatives we have been working on to help address these three core challenges. First of all, ending the pandemic. Look, we recognized very early on, about March in the year, I suppose, year zero of the pandemic, that it was important, bearing in mind the role of the ICC, that I turn all the organs of the ICC into a united front to actually battle against COVID because of the damage that was being wrought so quickly to the global economy, and in particular to the real economy. And we recognized early on that the only way for businesses to survive and livelihoods to be saved was to quickly end this acute phase of the pandemic and get back to business as normal. We are unfortunately clearly not past COVID-19. We're not living in a post-COVID-19 world, and it still is in our midst. And while many in today's audiences in the UK have benefited from early and widespread access to vaccines in many other parts of the world, and let's not forget the ICC is constituted by more than 66% now of emerging and developing economies. And so we see this, we feel this, we're involved with this in so many parts of the world, because in so many parts of the rest of the world, access to the very life-saving vaccines which are available in the UK and treatments and tests are much more limited. In fact, in some cases, still at 0.01%. So this is something to really understand. And it's important that the global north must ensure that the global south gets the tools required to combat COVID-19 as quickly as possible, and that the health systems there are strengthened so that they can manage the pandemic as well as possible. Now, we've been arguing this for some time, not as a matter of charity, but as a matter of economic common sense, and actually a critical issue, therefore, for the global world to think about. For us, a global and equitable vaccine rollout is necessary not for moral reasons, but for public health reasons, but also for economic reasons indeed. In fact, I took strong objection to the way in which the issue had been characterized, particularly by a number of developed nations, that there is an act of charity to make available to them vaccines. It is not. One of the things we actually did very early on was to shift that debate to the economic effects of vaccine nationalism and the hugely deleterious effects of that. We did a lot of work on this because of I suppose the shock I felt when I saw the issue was dismissed merely as a charity issue and failing to understand the economic impact. We worked to develop an economic study with colleagues at Harvard and elsewhere that predicted, frankly, accurately now, that supply chain disruptions, the ones that we now see taking place, would be a drag on growth in the developed world. We identified precisely down to the very sectors and geographies affected, all as a result of an ineffective and inequitable rollout of vaccines to the global world. We've presented, and we've been lucky, and I suppose it's a tribute in a way to the ICC, that when people thought about how do we ensure that there's a private sector voice on the WHO's COVAX facility, it was the ICC and me that was invited to participate in that. The relevance of that is COVAX is the best design process we have to get vaccines to the world's poorest nations. It's not sufficient in itself, but it is an incredibly important element of global cooperation enabling this to happen. The ICC has enabled more than $1 billion in contributions to the global fight against the virus, working with major companies, and I really do shout out to companies like MasterCard here and civil society organizations to do that. And what's more, the ICC, working with our national committees and corporations, we've developed life-saving supplies in some cases in particular geographies. We created war rooms. In fact, I see that we have a representative from Crown Agent on the call today. We created a war room with Crown agents around Uganda when there was a crisis over access to ventilators. What we do basically in a war room is have a single-minded focus on seeing if we can access and solve the problem, which is what we hopefully tried to support doing in Uganda. And similarly, in the worst moments of the crisis in India, let's not forget that's not that long ago when we had people dying in the streets. We had people unable to access beds in hospitals. We had arbitrage taking place about, again, access to ventilators. The ICC ran another war room to enable access to financing. We actually raised money to actually get access to those things. These are practical things we do. So when the new ICC puts its full institutional weight behind a challenge, even as big as COVID-19, frankly, we can make and we have made a huge difference. But the challenges and risks of an inequitable global distribution remain. So long as COVID remains out of control anywhere in the world, there is a risk that new variants will emerge that will render our existing tools ineffective. And we could see COVID bounce back in parts of the world where it currently seems under control. And there's also the more immediate reality that COVID has massively dampened economic activity. And owing to the global nature of today's supply chains, foreign countries suffering from COVID will also reduce economic opportunities at home. That's why ICC has been calling for and engaging with governments, especially in the G7 and G20, to fully fund the ACT Accelerator, which really is our clearest existing exit strategy, and yet remains woefully underfunded to the tune of around $18 billion. $1 A big number, that sounds, but compared to the stimulus package that's been offered, it's chicken feed. Second, we need to urgently deal with unique challenges COVID has created. The past 2 years has created enormous, previously unthinkable challenges to the global trading system. Goods trade naturally fell precipitously as lockdowns imposed and borders closed, causing major supply chain disruptions. Cross-border investments dropped even further, since creating new business opportunities normally requires people crossing borders, in-person meetings, and that now antiquated practice, remember that, of shaking hands. Shipping costs have skyrocketed owing to changing consumption patterns. The rapid uptake of e-commerce, port lockdowns, and container ships have been taken out of services. And all that while governments have embraced a raft of protectionist, or at the very least precautionist measures in attempts to secure supplies of essential medical goods and minimize the domestic impacts of supply chain disruptions. The disaster is not so far from our memory, and yet we repeated it with the ventilators, and yet we're repeating it again in many respects with access to essential elements to support the distribution of vaccines. But over this period, we at ICC have taken practical lean-in policy positions. We've actually created movements and we've led on issues like developing innovative systems for reopening international travel. We actually led on the issue of how you re-establish global mobility. We've led a major global campaign to prioritize saving SMEs, which were hit hardest by the economic downturn and public health restrictions. We actually created solutions about how you can get access to cash and actually distribute it to SMEs, not just in developed countries, but in developing and emerging countries. We actually engaged with regional development banks about how they can change their actual modus of delivery of finance to get that money out in Ecuador, get that money out in Uganda. All these sort of things we did. And we've argued strongly with governments against imposing and interfering with complex global supply chains or imposing trade restrictions on medical goods. It's unfathomable still to many of us, the restrictions that were placed on just access to the therapeutics that can be so useful in combating the effects of COVID. And we've developed practical solutions to stabilize medical supply chains. Our whole focus in ending the pandemic is actually about increasing the access to vaccines, which is actually about increasing production of vaccines and their safe distribution. And so we actually do believe that stabilizing medical supply chains is critical. We've proposed an innovative solution, which is the creation of a health market information system that I've argued for with G7, G20, with APEC, the WHO, the WTO, and on we go. And it does have support, because what we want to do is create much greater visibility over supply chain bottlenecks and pain points to allow for their speedy resolution. And if nothing else, we also have to ensure that we're building in the muscle in the global system to enable us to deal much better with a pandemic if it ever comes again. But there's still much work to be done now, because we're not out of the woods yet. And there's still much work to be done to ensure governments do not bake in harmful trade and investment policies. And I think some of the other speakers will talk about that subsequently. Thirdly, we must not lose focus on the long-term and meaningfully address the greatest systemic challenges of our time. We are meeting here today on the eve of the next major meeting of world leaders, first on climate change, COP26, and of trade ministers for the WTO Ministerial Conference. The twin challenges of combating climate change and reviving the global trading system are two of our major priorities at ICC. And as the principal business interlocutor for both the UNFCCC and the WTO, amongst many, many others now, we are working very closely with these organizations and the member states to push for ambitious outcomes that can help our economies better work, grow the economy, and actually ensure that we actually advance sustainability, key things that we do. And in fact, hosting major business events in the margins of both conferences. So the largest business events which will seek to influence the activities on the ground in COP26 will be run by the ICC, and ditto when we get to the ministerial meeting later on for the WTO. Our whole idea is to create an environment where it's easier for governments and for leaders to make the better choices about what will lead to the successful outcome of COP26 and of the MC12 process. And 2 months, because 2 months out from MC12, for example, governments simply look set to roll over today's problems to tomorrow. They're continuing to talk about the need for reform, but do little about it. And they're actually trying to shift the responsibility for the WTO Ministerial Conference of number 12 onto the shoulders of Dr. Ngozi. So as somehow it's her sole responsibility to ensure it's successful. What a load of nonsense. This is the responsibility of trade ministers. This is the responsibility of leaders. There is no point continuing to talk about reform. You've got to do something about it. Ministers have professed a commitment to the system, but they've shied away from making any compromises or concessions to enable agreement. All of which means that the WTO's ability to write rules and disputes and settle disputes, both of which matter deeply to global business, are ossifying. In fact, the WTO went missing during the worst stages of COVID-19. It's only really recently, with our urging, that we've been able to get them back in the park. At least there's something to talk about. Health is an issue, something to talk about the need to actually enable smooth access to supply chains. Business looks at the situation where it is and says it's just not good enough. And instead of letting the WTO drift into irrelevance, governments must take seriously WTO reform through leader-level engagement, once and for all finalise the only multilateral negotiations on foot at the moment, which are around fisheries subsidies, and they've been promising to do that for 21 years, and get serious about trade and climate change. You can't deal with these issues separately. They have to be joined up. There has to be a capacity to join up to allow systemic change so that we can all together have a higher probability of reaching the Paris targets. And for God's sake, we've got to write rules fit for the 21st century, especially on the digital economy. These are all elements of the WTO agenda that we're putting forward. And that's what we're pushing to trade ministers and to leaders, and will continue to push over the next month or so. Similarly, on climate change, we're hearing many, many grand statements and pledges from governments. But let's be very clear. Voluntary commitments are not enough to keep the world on a 1.5-degree pathway. We need governments to step up and set out credible plans and policies that work with business and the communities they serve to accelerate the pace of decarbonisation. In short, the what. Net zero's emissions by 2050 must now come with the how. Clarity on structural changes and policies to drive achievement. And that's what we're focused on. And this is where ICC and our business members have a key role to play, to work with governments to develop an effective framework that works for the real economy. Right now, we are working on a groundbreaking study on how global trade rules need to be reconfigured to enable a circular economy to actually effectively work, which is a really key aspect of increasing the possibility of having a climate neutral outcome. We are putting together a white paper setting out how changes to the remit of export credit agencies could boost the availability of CapEx for the projects needed to enable sustainable development by almost $1 trillion. We want governments to look at these practical solutions as well. And bearing in mind what's going on with carbon trading already and the multitude of systems that are operating, we are building a best practice model which can be used by governments for the discussion around Article 6. And we have been setting out and running a campaign on the business case for implementation of the Paris Agreement's provisions on cross-border emissions trading, which is Article 6. And finally, we know that we've got to get the industry taxonomy right to actually enable a sustainable trade and trade finance transaction, a beta version of which we will be launching at COP26. So from policy to campaigns, to practical tools, to solutions, to building toolboxes, that's what we're doing to support COP26. It's exactly the same as we're doing with the WTO, and what we also did and are continuing to do during the nightmare, which has been the COVID period and the pandemic. It's a challenging environment, and I hope you can join me in our work to help end the acute phase of the pandemic through global vaccine equity and make sure governments adopt reasonable and not counterproductive policy frameworks while dealing with the new frictions in the global economy, and develop practical solutions to shore up the trading system and move to a low carbon future. That's what we want: growing the global economy, revitalizing trade, and advancing sustainability. That's why the ICC is an indispensable partner for the global world as we move into the 21st century.
Many thanks, John. That was terrific. And for any of those who are with us today who aren't aware of what the ICC is, then I hope you got a good blast of who we are and what we do. And I think in the context of this session here, got a flavour of just how important it has been for us to help do everything we can to fight COVID. So I'd like to now introduce you, everybody, to our second keynote speaker, Baroness Ruby McGregor-Smith. Baroness Ruby is the current president of the British Chambers of Commerce, but also the chair of the UK Airport Operators Association, which in the context of COVID, we're looking for a view from both of those perspectives. Over to you, Baroness.
Thank you very much, and a real pleasure to be here today. If I talk a little bit first about my role at the British Chambers of Commerce and the challenges and also the opportunities that I think we very much faced. We at BCC produce a regular quarterly economic survey, and our stats for Q2 in 2020, which was the height of the pandemic, showed the largest decline we'd ever seen in the history of our survey for key indicators for organisations, large and small, on cash flows and revenues in particular. And now more recently to Q3 2021, we've seen that conditions still remain fairly weak. We have seen better revenues with some stabilisation in the professional services sector, but we still think cash flow and ongoing investment, particularly for smaller organisations, remains a real challenge. And if I take a look at some of the thematic issues that we face, I think very much it's around inflation, recruitment, and supply chain challenges, which are proving to be really very complex as we start to come out of the acute phase of this pandemic. And just moving now on to some of the supply chain disruption that we're seeing here. Many of our members have said that they've been struggling to really move goods by sea or air. Particular changes around the COVID period, that still continues. ONS has stated for September here that more than one in three businesses have experienced problems in sourcing materials, goods and services at home or have had to change suppliers. And we have found now that in Q2 2021, we have seen that nearly 3 in 4 exporters in the UK have recorded no sales growth at all. And these supply chain challenges are globalized, as the IMF has recently posted. We've seen significant costs in shipping. As an example, for some of our organisations, it's up 700 to 800% for certain containers. And I think that continued global disruption is here for a while. In terms of what we at BCC have done, we focus very much on how we rebuild coming out of this economy and what we can recommend to the UK government. And we think there's an opportunity for business to work with government, not just to go back to where we were before the pandemic, but to go on to a better, a greener and a more productive future for us all. So we've set that out in detail to the government in our rebuild plan. And we've talked about 5 main themes. The first is we need to remember, of course, that the virus is still here and to continue to manage the virus response in a way that can really support businesses survive and also to thrive. We need to continue to nurture those that have debts while supercharging growth. If ever there was a time to invest from the UK government, it is now. We absolutely have to build an ambitious global trade strategy. We have to absolutely have the right skills for the jobs of today, but also the jobs of tomorrow, which are changing rapidly. And finally, we have to very much invest in the UK, in the places where we live, we work, and we study. When I think about how businesses had to adapt, it's had no choice but to adapt. Whether that's meant we all move to virtual, whether that means hybrid practices, whether it means more digitalization or automation, every single organisation has had to adapt over the last 18 months. Many have either reshored or offshored. Many have thought very differently about the way in which they will continue to work and where they will continue to work. And it's been really tough. One of the big things I think that we have still yet to have underestimated is the mental health impact on so many and what they have faced during this pandemic. Certainly from an employee well-being perspective, I think that is on the top of pretty much every CEO's list in the UK. Moving on now a little to aviation, where I chair the AOA. And I have never seen numbers quite like it. Passenger revenues during the height of the pandemic were down 80%. Daily losses in January 21 for the UK airports were 5.3 million per day. During the depths of the pandemic, we saw passenger numbers down by 99%, and we saw international passenger demand back to the 1980s level. We've seen around 860,000 UK aviation travel and tourism jobs were lost or sustained only due partly to the government furlough schemes. And some airports in the UK have had to reduce their staffing levels by up to 40%. And even by the end of July 2021, 51% of people working in air transport were still on furlough. We've seen the economic impact of this industry decrease by 89% since the beginning of 2021. And the government support for the industry, and we've noticed that every government has done this differently, but certainly in the UK, the 7 billion support offered so far, mainly in the form of loans, just isn't going to be enough. Prior to COVID-19, the UK aviation industry supported around 1 million jobs here, and it contributed 57% to the economy, 57 billion to the economy. And we've supported a further 465,000 jobs through aviation-related travel and tourism. And ACI Europe have said very much that for 10% connectivity growth, GDP does grow by 0.5%. We find still today that we are still one of the countries with many, many restrictions on travel. Although that's beginning to ease, it hasn't restored passenger confidence to where it can be. More and more, we've seen that other governments have stepped in more to really support the aviation industry. My concern is that we're still very much an outlier among the developed economies, and that is not good for us. What we have to do, and we've recommended very much the UK government, is we have to reduce and remove the restrictions to travel across the UK and to other countries. We absolutely know that the continued impact is going to be a challenge, as we know that the global vaccination programme is still not going to be going at the same pace it has here or in many other countries that have done well. We don't expect to see passenger numbers return until the late 2020s. And we still continue to call in the UK for an aviation package that will help our aviation sector recover. We fully recognise the challenges of decarbonisation that are coming as well, but I think more support will be necessary to ensure we return to be the third biggest aviation player in the world. And finally, the challenges of borders, they seem to continue. Those border challenges absolutely have to be resolved, because we absolutely are very, very dependent upon our aviation industry here in the UK. So when I reflect back on the lessons that we have learned and what we can also learn from other countries, I think very much when I look at the risk management and our lack of being ready for a pandemic, I think that is something we can never let happen again. We're still not through this one. One day, it's very likely we could have another one. We absolutely have to be ready for whatever is coming to us next. I would also reflect that some of the communication that we saw during the pandemic has not been helpful to business, and we hope over time that will continue to improve. We absolutely now can rebound, but we need connectivity back to where it was. We need all trade barriers taken out. And finally, I would say, as businesses does emerge, as it has started to emerge from this, there are many things that we can all learn from it. I think the challenge is coming, but the support that we can give towards a decarbonisation agenda, what we can also do around digitalisation in our businesses, but also there's a huge amount more we can be excited about. And we implore certainly the UK government to help us continue to be excited and want to invest to get a better place for global Britain. Thank you.
Many thanks, Baroness. Some good numbers there on the UK aviation sector, and I'm interested to know in the chat room whether that resonates with other parts of the world. It's obviously a key part of the trade infrastructure that we talk about an awful lot. Our next speaker moderator, I should say, is Damien Bruckard. He's our Global Policy Director for Trade and Investment at ICC, so we're in good hands. And will take us through the panel with our terrific list of speakers. Over to you, Damien.
Well, thank you very much, Chris, and also to Mr. Denton and Baroness Ruby for those insightful opening remarks that really set the stage very well for the panel conversation we're going to have now. And the theme, as you can see on the slides here of today's discussion, is how to reset the global economy and keep trade open while still trying to manage a global pandemic. No mean feat, but thankfully we are joined by a really diverse range of experts who have all been involved in the management of the pandemic from very distinct vantage points. So we have with us Dr. Bruce Elwood, the Senior Advisor to the Director General of the World Health Organization, and who has been coordinating the Access to COVID-19 Tools Accelerator. This is the multilateral effort to ensure the global equitable access to tests, treatments, and vaccines, of which COVAX is but one part. We also have with us Paul Wafer, the Chief Strategy Officer of Crown Agents. For those who do not know Crown Agents, it's a non-profit international development company specializing in supply chain delivery, government system strengthening, and fund management. and which has done much in responding to COVID-19 all around the world. We also have with us Dr. Catherine Duggan, the CEO of the International Pharmaceutical Federation, the global body representing over 4 million pharmacists and pharmaceutical scientists who we have all had many interactions with over the last year, no doubt. And finally, Jana Reems, the economist and partner at the McKinsey Global Institute, who leads the Institute's research on competitiveness, growth, health, and urbanization, and has done some very interesting recent work on both shipping and health, which we'll come to later in today's conversation. Where what we'll be trying to do is hear different public health, macroeconomic, and industry perspectives, with a view to pulling together some key recommendations, both for policymakers and for businesses alike, about how they can meet the biggest challenges affecting not only British businesses, but those all around the world. So we really can't start any conversation about recovery from the pandemic without first having a grasp of the prospects for us controlling COVID-19 in the first place. So the majority of viewers today are, of course, in wealthy, industrialized countries that have already had successful vaccine rollouts. But that is not the overall state of the world, and the public health situation varies greatly country by country. So I'd like to first turn to Dr. Bruce Aylward. As someone at the very forefront of the global response to the pandemic, could you please give us an overview of the global public health situation and what is really still needed to get somewhat back to normal?
Thank you very much, Damien. And before jumping in on the situation we are in today and where we're headed, just a huge shout out to you, John, for the fantastic work you've done in bringing the ICC so close to this response in such an important role. And thank you also to Baroness Ruby for those introductory comments that helped set the stage. Let me say a few words about where we are, where we're headed, and then perhaps a word on what's still needed, but we're going to come back to that, Damien, throughout. So in terms of where we are in the midst of a pandemic. We need to be super clear on that. Last week, there were 2.5 million cases of this disease or were reported around the world. There were 40,000 deaths reported. There were probably more. Now, to put that in context, if you go back, so that means we have about 7,000 deaths a day globally. If we go back exactly 1 year to the pre-vaccine period that John and Ruben were talking about, we had 5,000 deaths a day. So we've got 7,000 deaths a day today, 5,000. We're not out of this by a long shot. And what people forget is in Europe, cases are increasing. That brings me to the second big difference that we see today versus last year. We now have what we call a two-track pandemic. That's a dangerous term because it describes the epidemiology for everybody, not the consequences. And what I mean by that is a two-track pandemic means if you're in a country with high coverage, you're experiencing an epidemic where there's still cases, but a very low number of deaths because the vaccine has been proven, every one of these vaccines, to reduce hospitalizations and death. Everyone knows that. If you're in a low-income country, it's a different picture. You got a high number of cases and a high number of deaths. And that's reflected in the numbers I just talked about. And I highlight this, Damien, just to remind everybody, we are still in this pandemic. Last week, I was invited on a BBC show, and the person right before me, the announcer made the mistake of saying to the interviewer just before me, so now that we're in the post-pandemic period, blah, 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 blah. And then he came to me, and so much for the interview that he planned to do, because I had to spend the time explaining that actually we're very much still in it. Now, the other thing that's important to this audience is we're going to stay in this pandemic because of the mistakes we are making today longer than we need to. We need to be super clear. More healthcare workers are going to get sick than need to. More people are going to die than need to. More drag of an economy, more losses than there needs to be because of the way that we are managing this pandemic. It's as plain and simple as that. The choices we are making are prolonging this pandemic. So that's a few words about where we are. On that bright, cheery note, let me just go to where we're headed. Unless we change some of the choices we're making about the use of the tools that we have at our disposal today, we are going to prolong the pandemic, as I've said. So let's talk, when we talk about where we're headed, it's a function of two things, the vaccines and the virus. The virus is evolving, you know that. We're getting more transmissible variants, which means you've got to achieve higher coverage to get control, and you need to rely on your other tools more than you expected. Now, some countries with high coverage are still having a lot of deaths because they've decided, you know what, we don't need any masks or social distancing or anything whatsoever. And they're paying a huge price for it in lives, and they're going to wake up to that. So this is one thing to remember as well. But the second thing to remember is while the virus is evolving, it's not evolving in a way that we can't beat it with the vaccines we have. And that brings us to the second part, right? The vaccines we have, we've seen their power and their promise. Every one of these reduce hospitalizations and deaths. A little bit of difference in how well they do that, but they all are formidable. But the limitation is we can't vaccinate our way out of this. We have got to be using all of the tools. If we don't do this in the near future, let me say one more word about where we're headed. We will have 5 million more people die next year than we need to. We will have 5.3 trillion in economic losses over the next 5 years than we need to, depending on the choices we make. No one listens in terms of politicians these days to anyone more than they do to you, our industry and industry leaders who are out there telling them what's needed to get the economy going again. They depend on you, we depend on you, and we depend on your voice. I think as we go forward, Damien, we'll say a few more words about the specifics about what's needed, but what we need are fora exactly like this, where we talk about this, but more importantly, tomorrow, everybody on this call calls up the politicians that you have such huge influence over, and you tell them all the important things that John just said earlier about sharing the crucial products that we'll come back to that are crucial to getting out of this, because we're very much in a pandemic. We're going to stay here much longer than we need to if we don't start making the right choices. And we need huge influencers to help the right people make the right choices. About 20 people in the world who right now could make the decisions to get us out of this faster. And we'll come back and talk about them later. Damien.
Thanks very much, Bruce. That's super clear and slightly worrying, but hopefully the message really gets through that we can all help governments make the right decisions here and do the right thing. I'd like to now turn a little bit to the economic situation in slightly more detail, because Bruce, you've just said that if we don't get on top of this pandemic, we're talking about $5.3 trillion in lost output compared to what we could achieve over the next 5 years, which I think is an IMF forecast. But let's dig a little bit deeper into it by bringing in Jana Reams from McKinsey. I know McKinsey, of course, has been working with a wide range of businesses across different sectors and industries throughout the pandemic to help them respond to very quickly changing and difficult economic circumstances. To help us flesh out that economic context a little bit more, could you talk through a little bit what you're seeing as the most significant trends right now and over the next 5 years, bearing in mind this public health situation as described by Bruce?
Yeah, thank you very much, Damien. And just couldn't agree more with Bruce. It is very clear to us that we are facing a dual challenge of saving lives and livelihoods, and there is no way we are going to get the economy to look anything like normal unless we address the health challenges. So clearly that's job number one. But when you look at the economy, we actually are going to wait quite a bit longer to see anything that looks normal to us, and it may actually look quite different even at the time when we are over the pandemic in some time in the future. The reason is that this was a very unusual downturn. When the pandemic hit early on, most businesses expected it to look like the past downturns that we know, that people would be careful about spending their money, they were worried about the income and would cut down on particularly discretionary big purchases. And what happened here was dramatically different. Many people maintained their income while they were able to work from home, but were not able to spend their money. So household savings overall, they more than doubled in the US and the UK and grew by 50% in Western Europe overall. So a lot of people found themselves with more money than they expected. And what did they do with that money? They spent it on expanding and investing on and furnishment of their houses, gearing it up with Italian coffee makers and home gyms, etc. And in many cases, even buying recreational vehicles or second homes. And a lot of these goods actually are shipped and produced and transported, and this was exactly what companies weren't prepared for. And still today, more than 18 months down the lane, we still see people have more income than they expected. The demand is relatively robust, and we expect this to continue for quite a while because of the fact that many of the services that typically are a big source of spending for households, everything from restaurants and entertainment events to travel, are probably going to take a while. So for that reason, we expect this robust goods demand to continue. Of course, this was not the case for every household. Many self-employed and those who work in low-wage service industries were hard hit by the business closures, etc. Fortunately for them, a lot of the low-income households were supported by very strong stimulus funding. And the worry of many economists has been what happens when the stimulus funding is now waning down. It looks like the tight labor market and upward pressure on wages may help some of that, but that's definitely a segment to watch. So just to conclude, it's going to be a while before we'll see anything normal. This is an unusual, goods-heavy, services-light recovery. Yet, even when we get out of the acute phase of the pandemic, we will likely see some remnants of this in the fact that people have invested on their homes. We'll see more home consumption in the future. Businesses have adjusted. There's going to be 20% less international travel and business travel, very likely, as a result, and more work from home. And at the same time, a lot of businesses and individuals digitize their consumption. Let's take, for example, some of the baby boomers who might never have tried digital health or ordering food online. They had a very strong nudge last year to use that, and many of them liked it. So we might see a cohort that would have never become digital become an active user for the future. So in short, we'll see the trends that we have seen is downturn that are quite different from the past to continue for definitely months, potentially even longer. And when we come out of it, we probably will see quite a different new normal in many segments of the economy.
Thanks very much, Jana. That's super interesting. And one thing that I think this audience would be particularly interested in hearing a little bit more about there is how the effect on shipping and logistics, because it's quite clear now that, well, a lot of businesses are very worried about shipping prices. We've seen them skyrocket over the last couple of months. ICC, we're really about international trade and investment, and many of our members trade internationally. And so I was wondering if you could give some insight into why these prices have gone up so much, and what's really going on here.
A great question. And it really was the perfect storm of unexpected demand boom when most companies had actually downgraded their orders, thinking it was going to look like normal downturns where you don't see goods orders go up. And at the same time, the supply constraints that happened. So it was the demand and supply imbalance. We already talked about the demand side just earlier, but when companies realized that demand was actually continuing to be robust and potentially even more robust in many cases than it would have been in the no pandemic scenario, supply constraints started to happen, whether that was in factories where some of the factory suppliers were closed because of COVID outbreaks. That happened on ports where longshoremen were ill and were slowing down processes. And when you add to that a few of the unexpected bottlenecks, anybody remember Suez? Those actually led to pretty heavy bottlenecks and lines across the board. And over time, this has actually shifted to the onshore continuation from the arriving ports, where basically you don't have enough trucks and truckers who may be tired of the long waits. And frankly, some of them are choosing other employment opportunities, given that it has not been an easy field necessarily to be. So all of these on the supply side are probably going to take a number of months to work through. It takes a short supply chain change can cause a long bottleneck to uncover, to work itself through. And a lot of that is a result of what has happened over the last 15 years when companies have really built their global, low-cost, lean and mean supply chains that really weren't as robust for shocks as we had hoped. And I think the pandemic has really put that to test. So I think a lot of companies are potentially thinking about their supply chain strategies as a result, increasing particularly the resilience and having more redundancy across the board.
Thanks very much. And back to you, Bruce, actually, because these frictions in global shipping logistics are obviously having major consequences on the distribution of vaccines and the tools required to end the pandemic, which, as we've discussed, is a first-order priority for the world. What is your experience here with governments imposing trade policies? We've seen export bans on PPE, on components related to vaccines, having restricted the flow of essential goods. What impediments are you really seeing to the effective and efficient global distribution of the tools that you're promoting to end the pandemic?
Thanks, Damien. We have a simple problem here, right? Simple. We need to get more stuff to more people more quickly. It's as simple as that if we want to get out of this pandemic. And that stuff, of course, are the vaccines, but not only, also tests, so we know where we're headed. And then, of course, we need to be able to save lives. And when we look at what some of the impediments to this are today, right now, and sorry, John and others, I'm going to jump in and say this, but single biggest problem we have is with parts of industry. We do not have enough transparency to be able to properly manage and run a global response like this. We set up the COVAX instrument that John talked about earlier to ensure we could roll products out in a way to optimize, save the most lives possible, get the economy back and functioning as rapidly as possible, get a health system safe as rapidly as possible. And that requires us understanding how many doses are we going to receive by month for low middle income countries, which where a lot of the drag is right now, right? A lot of the gap in capacity. And here we are a year into production of these products. People know there are production capacities. People know what their supply chains look like for these products. And we cannot get clarity on what is actually going to be available next month. And without that, these countries with very weak systems, many of them, but very important in the global supply chain, they cannot plan their rollout of products. And so what happens is they're having to stop and start of their rollout of vaccines as well as other products, and they just can't get to scale properly. And what's going to happen is we're going to have this self-fulfilling prophecy, Damien, where all of a sudden we're going to drop hundreds of millions of doses of vaccines on these countries that aren't going to be able to absorb them. They're a little bit in this situation, where the boy who cried wolf, right? They keep saying, hey, the vaccines are coming, the vaccines are coming. Of course, they never come. And then eventually they come and too late, the systems just aren't there to do it. So first thing we need is transparency from industry to understand what product is coming when, so we can plan and optimize the use of these things. The second thing we need is we need the high income countries to play ball on this. Right now, the global supply of vaccines is controlled by basically 6 or 7 countries and 6 or 7 producers. That's it. And the choices those countries and those producers make dictate how quickly we're going to get out of this pandemic. I know it's more complicated than that. They've got boards and constituencies to answer to, but they've reaped their profits. They vaccinated their people. At what point do they start sharing the products? And sorry to be so tough on this, but we all want to get out of this as fast as we can, and we're still dragging it out because we don't have a sight line, not only from manufacturers, but also from others. And what we need number one, delivery swaps. Everybody keeps talking about a queue, and everybody in this, a delivery queue, a shipment queue, et cetera. And everybody on this call knows there's really no such thing. You make a decision on what you're going to ship when based on a whole bunch of factors. But one of them right now is not playing in the interest of the low and low middle income countries. So we've got to get that addressed. And we had a wonderful announcement celebrated in news a couple of months ago where the UK and Australia said they announced a great fanfare. We're going to swap doses, our space in the queue. We can't swap with COVAX, but 2 high-income countries with high coverage can swap space in a queue between them. So we've got to fix these kind of problems, Damien. I'm just calling a spade here. And then, of course, there are donations. Lots of great promises being made about donating vaccines. That's a third, fourth order solution because we still don't control the supply well enough to be able to plan and roll out product properly. But that's the next big thing that we've got to make sure accelerate, because lots of promises. We have 1.3, 1.5 billion doses promised of donations to try and get to the places that are behind. But the problem is we've received and been able to ship about 100 million, 120 million of those so far. So we need those things to move faster. So we need transparency. We need, delivery swaps where we can get them, delivery schedule swaps. We need donations. And then, as John highlighted, and I think Baroness Ruby did as well, at some point, we need to be able to expand production capacity, not in the existing sites, but also in places that are underserved and regions that are underserved, because quite frankly, if this pandemic's proven one thing, it's that we got to have a better distribution of production to be able to make it work. So those are a couple of quick reflections. But, Damien, just in wrapping up on this, the last thing we need to have is really buy-in and solidarity between common targets, right? If we can get 40% of the world vaccinated by the end of this year, we would, by and large, have the economy back on track. We're an awful lot more confidence in our ability to get there. The reality is now probably a third, a little bit more of the world's countries are not on track for that. It's a simple supply side problem. In some, it's going to be a delivery problem, but right now it's a supply side problem that we have to get solved. We can't do that without the other points that I just highlighted.
Thanks very much, Bruce. And I might quickly abuse my moderator's privilege and say on the transparency point, one thing that ICC has been advocating for some time is the creation of a health market information system modeled on the agricultural market information system, which provides much greater transparency over the relevant supply chains, including the vaccine supply chain, but also the other essential medical goods. And we can perhaps turn to that in Q&A. But now I'd like to bring in our other two panelists, Paul and Catherine. Let's start with you. We've just been discussing some of the logistical challenges. And of course, Crown Agents has been a major player in the procurement and distribution logistics directly relating to the pandemic, including stepping in where governments haven't done the greatest job, both with PPE and medical equipment early on in the pandemic, and now also with vaccines. This can't have been an easy job. And so we'd be really interested to hear how you have been handling those processes and the challenges that you're still seeing in getting vaccination to the higher levels that, that Bruce has been mentioning that we need to get to, that 40% level in the global south especially.
Yeah, thanks very much, Damien. Really good questions. So, as you said, Crown Agents has a long-standing history of supporting health in low and middle-income countries, particularly focusing on procurement and logistics, but also looking more broadly at the way that health systems need to be strengthened. And in the role that we've been playing with the COVID pandemic, we've now delivered more than 5 million doses of the vaccine to over 20 countries. Now, in many cases, the places that we've been delivering to, destinations have been extremely remote, very difficult to reach. They've been real complex logistical challenges. And I think that's a good way of setting up an answer to your question. So the challenges have been significant. And I think I want to draw attention to two issues in particular. The first is, when you see on the news or in social media photographs of planes landing at airports, the Minister of Health is there on the tarmac, and the vaccines have been delivered. I mean, I think we need to remember that that's only the first step in the journey. That actually, to some extent, that's the easiest part of the logistical challenge. If you take a country like South Sudan, for example, where we work, yes, you might be able to get the vaccines to Juba, the capital city, maybe a 5,000-mile journey from London. But actually, to get it another 250 kilometers from Juba to a rural area like Rumbek, that is going to be a significantly more challenging logistical issue in terms of temperature control, making sure that all parts of that system are working. And that's where we've been putting a lot of our focus. So those issues around the in-country last-mile logistics are really, really important and need to not be overlooked. It's much more complex, of course, with vaccines because of the need to have a cold chain and a temperature control as well. So that's really important. And then secondly, I think it's worth remembering that it's not just about the supply chain and the logistics either. If you want to have a cold chain so that vaccines are kept safe throughout their journey, then you need to have a regular, reliable supply of electricity. And we're talking about countries where in many places, rural health facilities just don't have that. So that's a real challenge that we also need to be addressing. And actually looking forward, we need to be thinking about what we've learned during this pandemic to try and address those issues into the future and make sure that that sort of change is fundamentally brought through. But it also requires not only a clinic where these things can be administered from, but a trained cohort of health workers and community health volunteers who know what they need to be doing, have been trained to do so, and can reach out and engage with the community. And then lastly, just to add to that, the successful rollout in many places is going to require that sort of engagement with the communities, because there's often a hesitancy to overcome in places where maybe this isn't seen as the #1 priority, or where indeed there isn't a long-standing history of active engagement with health services and trust in the system. So there's a whole series of combination of issues that need to be addressed together, even when you've addressed some of those issues right at the top of the chain that Bruce was talking about that are so compelling and challenging. But I mean, I think I just want to say that, you know, although this sounds really an impossible task, we have seen that with the right resources and the right commitment, even in the most fragile context like South Sudan, which we were talking about before, it is possible to get this done. So in that particular country, where we've been working as an organization for more than 10 years, we found that by partnering with Gavi, we've been able to work from an existing health program that was providing basic health services, and now pivot that to be able to make sure that vaccines are rolled out as well. So it is doable with the right commitment as well.
Thanks very much, Paul. And I guess that really, your last point there really speaks to the importance of that perhaps more nebulous pillar of the ACT Accelerated, which is strengthening healthcare systems, that this is really an investment in a much longer term future, not just for dealing with this pandemic, but future pandemics and other medical challenges. But your 2 points prior to that on needing a trained cohort of health workers and community engagement, I think is a really good segue to bring in Catherine here, because as the CEO of the International Pharmaceutical Federation, which represents pharmacists and the industry, this is very much the front line of the COVID pandemic. Despite us all having many interactions on a regular basis with pharmacists, we tend not to hear as much about how pharmacies and pharmacists have actually been affected and responded throughout the crisis. And so I was wondering if you could give us a sense of how COVID might have actually changed the role of pharmacies and pharmacists, how they've responded, and how has COVID impacted their operations.
Thanks so much, Damien, and colleagues who've gone before. I feel like I'm taking quite a specific example here, but I hope I do you all proud. As you rightly said, we represent around 4 million pharmacists and pharmaceutical scientists, around 150 member organisations in around 138 of the countries and territories. I myself am a pharmacist. I've had a background in community hospital, primary care and academia. Mainly based in the UK. The actual federation is based in The Hague, but I have found myself having to pivot our organisation, as have we all, as I took my final flight to The Hague, apart from a couple of recent trips, on the 12th of March 2020. So to your question, Damien, to the public, it almost seemed like pharmacy didn't change. Every community pharmacy, hospital pharmacist, the pharmaceutical scientists involved in drug development and drug delivery, and that isn't necessarily the supply of medicines, it's about how you might, the routes of administration, they remained pretty much in situ. And to us as a profession, the educators, the NGOs such as myself, the professional agencies and the regulators were there in the background as well. What I would say is, as our high streets and communities closed businesses and closed access, the community pharmacy remained open. And although we're the third largest health profession, we're not always the loudest on the block when it comes to advocacy. So this gave an opportunity for the profession to be seen by the public and patients that they serve, in real stark contrast to the emptiness that the other parts of their communities may have felt. They remained available, accessible and open. They ensured through the investment that they always make that there were safe supplies of medicines that the patients they serve need. And that's something I think that becomes like one of those invisible investments that a profession or an industry makes that came into sharp focus. They also had to protect their workforce that comes from the communities that they also serve. by investing in PPE, and that was not necessarily in wide availability for professions like pharmacy. Maybe in hospitals it was, because the hospitals would be supplied through the health services and the health systems in different countries, but the community pharmacists often remain contractors to health services, and they had to invest themselves. They then responded what I would call adeptly and quite flexibly. There were community pharmacists and pharmacies making hand sanitizers. They would hold clinics and surgeries, both using online services, but also patients in the public, with the changing evidence. And I think it was really striking to look back to a year and a half ago. Literally daily, we were seeing evidence changing around what medicines should we be taking, using, what were the therapies that were available, what was the evidence behind X, Y, and Z, what about drug repurposing? And the pharmacists were the front line for providing this advice. And then, of course, you have the human part of it, which is, I can't see my parent in their care home. I'm really worried. What am I going to do? How can I ensure that they know that we care for them? And what you found was that community pharmacists would often be the conduit for those messages into care homes, which didn't necessarily seem that big of an issue right at the start. But as people didn't see their relatives for a long time, this was really important. And not just elderly patients, but those that find themselves in care institutions. This drug repurposing was really interesting because there was a lot of mythology at the time, and that's something I think that the Build Back Better agenda needs to get right. We talk about communication, but we really need to think about what is a fact and what is an opinion, and to not have an opinion on whether a fact is a fact and then dismiss it because we don't like it. It's time now. We see this with the climate change crisis growing and growing, and with our supply chain crisis. Things should be fact-led and science-led, and that this would help us a lot with our hesitancy in some of our communities, but also some of the myth-busting that we all need to roll our sleeves up and take part in. What I would say is that in 2016, we saw 16 countries that had enabled pharmacists to take part in vaccinations, whether they be pneumococcal or influenza. Now it's more than 50, and that has come to pass as a result of evidence sharing, advocacy between countries, and also regulatory flexibility. And that's something, in my summing up, I would like to just address. But what I would say as well is that we are the third biggest health profession, I mentioned that, but very often the profession of pharmacy isn't noted when health ministers list off the health professions that are important to patients and the public, not on the lips of health ministries. We started to see it in different countries, and indeed we had competitions with the team about which health minister would be mentioning pharmacy and pharmacists first, second, third. And quite interesting, despite them being the investors in the communities, in the drugs they supply and ensuring availability, they weren't necessarily thought of as a port of call in health provision and indeed in business. Even in the reports of our partners, we're not always mentioned, we're almost invisible. And the pandemic has cast a really sharp focus on this. This isn't about professional protectionism from myself, although I have declared I am a pharmacist. This is about ensuring accessibility in all corners of our communities and the role that that profession can play in that picture. And I would say from investing ahead of securing the return in terms of the medicines that they would supply, in terms of the workforce, they just did it because they felt that was the right thing to do. And I think you saw that with a lot of different businesses, perhaps not health focused, where the real doing the right thing was the motivation for the professions. So my 3 key points for this Build Back Better agenda is we should ensure all professions are involved and engaged right from the very start. And when I say professions, that's because I'm in that area, but all businesses, you could mobilize. I think it was the CEO of the Crick Institute who said, in order to beat the battles, you don't just need the big businesses, you need lots of the small boats that can get involved as well to help with the mobilization. And we need to capitalize on the position that we occupy in our communities, the expertise and experience, To ensure regulatory changes in supply, this has been mentioned already, aren't reined back just because that's what we used to do pre-pandemic. But what has really helped us in these times, the availability of drugs, let's make sure that we're really ensuring that safety has to be implicit, but let's just make sure that we learn from this. And finally, I think pharmacists need to be invested in and also part of the investment. What about the digital health that Jana mentioned? There is a place for this in all of our lives, as well as the face-to-face. It's not a one or the other. Automation. And then, of course, we've been advocating for electricity. I think, Paul, you mentioned electricity supplies are needed in very many of our countries. Fridges to ensure safe supply of medicines. Contracts to ensure that the services are sustainable. And then the roles in vaccines. And may I say, another emergency that could be down the line is our antimicrobial resistance, which during the pandemic we've seen rail back as well. Thanks, Damien. I've said a lot. There's more I could say, but I look forward to the discussion that we're about to have. Thanks a million.
Fantastic. Thanks very much, Catherine. And I really love this summing up at the end with 3 very clear calls to action. And I think that's a great practice. And maybe we should go around the table and hear from everyone else what their top three recommendations to either policymakers or to businesses are in the same vein that you've just done. So perhaps starting with you, Bruce.
I think maybe 3 things. First, and they're to 3 different audiences, folks. First, to the high income countries and producing countries, right? We need a strong message from them to manufacturers to prioritize deliveries to COVAX so that they have enough product and that can have a predictable, sustainable supply of product. Because without that, Paul, I think you'd agree, the problem of the countries with weak systems gets a heck of a lot worse if they cannot predict what kind of a supply that they're going to have. So help bring predictability to that in sufficient volumes. The second recommendation is on those low income countries. They have a big role to play in this as well. They've got to build global confidence that the products are going to be used fast, effectively, efficiently in those countries. So they've got to build those capacities and take the rollout of these products extremely seriously. And most countries have done exactly that, but there's always places to improve and solve those last mile problems that Paul has been talking about. And then, the third set would be, Damien, to the corporations and the industry, right? The first is to use your voices, like we've talked about earlier, to advocate and help politicians make the difficult decisions that they need to make, because these aren't easy decisions about making sure products go where they're going to have the biggest impact at a global level. And so use your voices to help solve that first problem with the high incomes, the industries, but then use your assets to help solve that second problem of in-country delivery, because you've been dealing with these kind of problems for so long in so many of these environments. You're the experts about mobilizing populations, about getting them to do things that they don't always think they would normally do, or ask for products they might not always ask for. You guys are really, really good at this. So using your assets, your expertise in those environments is going to be crucial as well. And all of it, Damien, is getting all of those groups behind that common goals, right? Got to get the world to 40% vaccinated. By next year, we got to be gunning for 70% by the middle of the next year, or this pandemic's going to go on way longer than it needs to.
Top 3 recommendations, Ben. Paul, I think you're still on mute, but your top 3.
Sorry, Damien, I think I lost the connection for a second. Yeah, I'll keep it very simple. So obviously, building on what I was saying before, really important that we focus on the last mile, that we don't think the job is done just because things get to an airport. And that, I think, as Bruce was saying, really requires a sort of level of commitment and energy, particularly from partner governments themselves, but also, I think, funding and support from those in the global north that could assist that. So it's not just about whether they're making vaccines available, but also making sure that they're supporting the infrastructure that's required to get those out there. Secondly, I think putting health workers at the front of the response. I mean, we've been doing this as we go on, but I think it needs to continue to be reinforced. At the end of the day, we need to have people on the front line who are engaging with citizens and actually putting vaccines into people's arms. That's the most important part of this story. it's been a long-standing area that's been underinvested in, and I include in that group of health workers, pharmacists, of course. But it's really important that that we keep focusing on the health workers, keeping them alive so that they can protect the rest of us. And then thirdly, I think it's really important to try to get more examples of bottom-up pooling of expertise going. We've seen some really promising examples on the continent of Sub-Saharan Africa, where governments are starting to try to talk to each other, think about how they can pool resources. Can they pool their procurement? Can they sort of create a stronger voice by joining together? And I think that's really important and needs to complement the sort of global initiatives such as COVAX. So that would be my three.
Thanks very much. And Jana, your top three now.
Well, I have one for policymakers and two for companies. For policymakers, it really is to focus on improving our health and addressing the pandemic. And this needs to be done globally. The virus doesn't stop on the borders. For businesses, my first advice is take advantage of the changes in way business is done in digitization to sustainably invest on more productive, more efficient, better customer service on your operations. Don't just stop on being able to operate as needed for the pandemic. Take this as an opportunity as your workforce as well as your customers are getting used to new digital. Think of how you can do things better in the future. And last, for businesses, think about the way you work. Many people are rethinking their lives, and as a result, they are leaving the labor force and changing jobs at record rates. This is the time to find a way to be a better boss and attract people to your company and avoid the fact that you won't be losing those so important workers.
Fantastic, thanks very much. And we've actually got a few more minutes left here, and a few questions have come in. So before we wrap up, I might just take one initially from where it's gone, from, I think it was Dorothy, who was asking a question about whether we can expect a bigger vaccine commitment from the G7 this year, and what should we expect from the G20. So this is probably best directed to Bruce.
Yeah, the G20 is the key forum, right? Because this one brings together the high contracting countries, the producing country, the big producing countries, as well as some of the big countries that will drive the scale up, let's say, in the South. So the G20, there's been a lot of focus on future pandemic preparedness, and it's only very recently that they're sort of coming full circle and saying, hang on a minute, we're not far enough with this one, we need to come back to this one. So what we're looking for, we're going to launch a new strategic plan and budget for the ACT Accelerator on the 25th or 26th, sometime in that time period of October, that will lay out, this is what we need to do to get to equity. This is what it's going to cost. We need them to get behind that. That's what we're looking for, make the commitments to its financing, and especially to make that near-term commitment to helping the world achieve the 40%, at least supply, let's say, vaccine supply to cover 40% of population in every country by the end of 2021. So that's what we're really gunning for. The G7's a little further out. We will stock take before we get there based on what the G20 does in about 10 days' time.
Great. And one more here is for, I think, Paul, about travel restrictions and the extent to which this has had an impact on your work. And whether how important it is for travel restrictions to be eased in any way. Just bearing in mind, I think we've got 2 minutes left.
Yeah, I'll be very brief. I mean, obviously, I've been talking a lot about logistics and supply chain, but actually 2 other parts of our core business are absolutely essential, have historically been completely reliant on travel. So one of those is around provision of technical assistance and support to governments in the Global South in particular. And the traditional model, of course, was that you'd have people who would often come from around the world with different expertise. They would fly in and support governments. That's been absolutely impossible to do over the last 18 months. And at first it looked like it was going to be a real challenge. I think like every other sector and industry, we've adapted and learned different ways of working. And I think it's been amazing what we've been able to achieve in that area, in spite of not being able to see people face to face. But I think the new normal of hybrid working that enables people to continue to have relationships and support each other remotely, but combined with the ability to meet face to face as well, is going to be really important. And then secondly, of course, in similar vein, we've had a long-standing program of offering training and professional development through face-to-face courses, particularly in the UK, the US, and Dubai, mainly focused at senior civil servants coming from the global south. And again, that completely dried up and was impossible to carry on. That has been adapted. We have moved towards sort of e-learning platforms, but again, I think we want to try to move to a new normal that's a mix of what we can do remotely and what we can do face-to-face. So I think there's obviously been real frustration about the slowness to lift travel restrictions in places like the UK, and then even when they have been announced as a fanfare of restriction lifting, looking at the small print and realizing, well, it depends where you got your vaccines. And that's been a real challenge and something that our clients in particular have been really frustrated about.
Speaking of frustration, unfortunately, this brings us to the end of our allotted time. So I'd like to thank all of the speakers for really wonderful presentations, insightful commentary, and very clear calls to action about what businesses and policymakers and organizations like ICC and their national committees can really do to help bring a quick end to this pandemic. So without any further ado, I'd like to thank everyone for speaking and watching today, and hand back to Chris to close up the session.
Well, thanks very much, Damien, and thanks so much to our panel. I think that was a really sobering session, I think, but it's a really good reminder of just the task ahead, isn't it? You know, we can't take our focus off this pandemic. We've got to solve this issue. That's been a running theme through the day. But on the plus side, I think it's a really good call to action on exactly what needs to be done. And if industry, as we've heard all day, work together with governments and wider stakeholders, we can do this. It's about commitment, it's about focus, and it's about being persistent to achieve the task. So that brings us to the end of day one. The next session will be in the morning, focusing on climate. Tomorrow is Climate Sustainability Day. So we'll be looking at the net zero challenge. How do we deliver that? And what sort of innovative approaches are out there to help us deliver net zero? That will be going on at 9 o'clock in the morning, British Standard Time, and we'll look forward to seeing you then. Thank you very much, everybody.